It's meant to act as a way to keep people out of the criminal justice system and instead get them into the healthcare system. It's part of Metro's Partners in Care program.
And it started today in every precinct in the county. News 2's My Owens was there as they kicked off their first shift and shows us how the department is already seeing success.
Inside the West Precinct.
Sergeant Honeycutt's here. Sergeant Predigo's here, Marvin's here.
It's the first roll call to a final chapter in bringing mental health help to the public.
We added the goal of expanding this thing countywide. This is what this is. This is the last precinct to come online, so we're now countywide program. No more does any precinct have to go, hey, can we borrow a co-response car from another precinct?
The program partners a mental health clinician with a trained Metro officer to respond to behavioral health calls.
About half the people we see are needing a traditional crisis assessment. So there's either some sort of suicidal thoughts again or some sort of psychosis going on where we needed to have a safety plan or get them into treatment or, really in-depth go into this case, and that's happening half the time.
Already the program has been put to use. Since its start, Partners in Care units have responded to more than 27,000 calls. That includes more than 6,000 mental health crises.
I think it is an encouraging number as well because we are being utilized. We're helping people who have not traditionally been helped, and we're really trying to support our first responders and with a population that they are now dealing with on a daily basis.
Each team has a master's level clinician and a police officer that works together. And once a scene is stabilized and no longer a physical threat, the clinician can step in and assess them.
But if you don't have the research there quick enough, it can escalate just based on how humans get impatient. We have that where we don't have that delay anymore, and we can get individuals plugged into the care that they need a lot faster.
The goal is to keep people out of the criminal justice system and get them the health care that they need.
They don't have the best resources in a jail setting, and we know that. And I know that there's times in the past we might have wanted to divert to a better form of care, but we didn't have that option, and we have that option now.
My Owens, News 2.